if you're taking this and it's working for you and your scans show that everything is stable or not progressing, you're great. We'll take that. If you're
Okay.
not progressing, that's fantastic. But once you start to progress, so the bone scan shows progression of disease in the bones, or
Okay.
the CAT scan shows worsening of disease in the liver or lung, and you might start feeling unwell as well because now your cancer isn't so well controlled.
Right.
So once that happens, there are different biological mechanisms of resistance. So something's happened in those cancer cells that have
Yeah.
made them no longer responsive to that first line therapy. Now, hopefully, you've done really well. It's taken you 3, 4 years before that's happened. But
Yeah.
once that happens, we need to find out why. And that's where we look for mutation mechanisms. And we can look for mutations by doing a rebiopsy of the areas that are growing, or do liquid biopsies. We take out serum from the patient's bloodstream and look for mutations that may be seen in the bloodstream that represent the resistance pathways that are in the patient's breast cancer. So the two important mutations that happened in metastatic ER positive breast cancer. One of the single most important mutations is something called an ESR1 mutation, ESR1. So as an oncologist, I'm looking to see if a patient has developed the ESR1 mutation. The ESR1 mutations generally are best managed by switching the class of the anti-estrogen therapy. What's happened is basically the estrogen receptor has developed an abnormality in it where it's switched on permanently. So it doesn't matter whether you got rid of the estrogen, it doesn't matter whether you block it with tamoxifen, it's switched on permanently. So when we see ESR1 mutations, we generally like to change the class of drug to a different anti-estrogen therapy.